all participants ready to begin? Thumbs up. Okay, perfect. Great. Good afternoon, everyone. Thank you for joining the Healthcare Heroes webinar. And we are very excited to be able to share with you the topic on how to beat the bureaucracy to sell to hospitals. I am your host, Sandy Yong, and I'm also an author, speaker, and investor. Just so everyone knows, your microphones have been muted except for the presenters for today, and your video has been turned off. If you do have any questions, feel free to put your questions in the Q&A box at the bottom here, and I will moderate them throughout the presentation and most likely ask some of the questions towards the end of the presentation. Today's webinar will be recorded and a link will be provided via email where you will be able to access the recording at a later date. So let's get started. First, we'd like to learn a little bit more about our participants on today's webinar. And so I will just start the poll here. And we'll just give it a moment here, and I'll just play some background music.
You have an echo.
Okay, and I'm just going to test my microphone for 1 minute. Just bear with me for a second. Okay. Can you guys hear me? Good. Sorry, is it echoing still?
A little bit. I don't know why. Mm-hmm.
I think we're okay. All right. Okay, so let's see here. Okay, and I'm just going to end the poll here. And I would just say that it looks like we've got people who are newer to the sales space who are just starting out or maybe have about 2 years or less in experience. And we've got some business owners and also entrepreneurs and people who are in sales. Okay, so now that we've concluded our poll, Mary, if you would like to share your presentation.
Sure.
And so for those of you who may not have heard of Mary, Mary Piepenbrink is a Senior Vice President of Sales at Lightning Bolt. Mary has a nursing background and 20 years of sales management experience in health informatics, advanced analytics, and artificial intelligence solutions. She is also has experience with UX and user experience teams on clinical application design, and she has overseen marketing teams. Let's give a warm welcome to Mary.
Thank you. You need to give me permission to share, I think.
Just give me one moment here.
Of course.
Okay, so Mary, you should be able to see the share screen option.
Fantastic. It's coming right up. And if you guys can see my love, that sailboat, that was a happy day. You all see my screen?
Yes, we do.
Okay, great. So I'll tell you just a little, and welcome and thank you. It's so difficult because the Zoom meetings I do, I could see everybody, but I'm going to trust that you're there and hope we enjoy the next few minutes together. Let me tell you how Lightning Bolt fits into the company that owns us. We were acquired about a year and a half ago. And the cool thing is Lightning Bolt has become part of a Perfect Serve family. And what we do are things that help providers communicate, less friction in their workflow, things that help support them be the amazing clinicians that they are to help our patients. And so we do secure messaging. And we do call transfer centers in health systems where folks are calling in and we're trying to get them with the right offices or the right practices or the right provider. We do patient family direct communication securely. Of course, what Lightning Bolt does is primarily provider scheduling. And so we fit into this continuum and integrate with all of those gray box or gray circles there at the bottom. So let's move in right into how Lightning Bolt helps. So when I'm talking to especially health system enterprise customers selling advanced solutions, primarily software, it's a little bit more difficult or complex, if you will, than say, hey, I've got this device, it hooks into that, it does this, we're done. So really this is what we do. We could say it's provider scheduling, but really what we're trying to accomplish is value, not just for the provider, the physician, the practice that physician works in outside of the health system, but also when that provider goes into the health system, and how do all the folks in the hospitals interact, communicate, locate, figure out where a provider is, and that's where Lightning Bolt comes in. So we're a piece of a bigger strategy and a bigger value. So what I like to do is say, you know, we're a single instance enterprise platform. That rings for IT folks because it's scalable. It's an instance. We don't have little pockets and things going on everywhere. And it also means it's connected. And I'll show you what that means a little bit more when we get into it. But there's also a single integration source. IT, information technology, CIOs, that is important. It should be important to everyone from a resource perspective, from a fewer points of failure perspective, and from a time and money perspective. And what we do is we give digital, real-time, dynamic access to provider schedules, and most particularly who's on call. So if I'm an ED physician and I have a patient with maybe needs surgery, or I think the patient needs surgery, I'm going to figure out who's on call for surgery at that moment in time. And if I can do that on my device, and the schedule, the on-call schedules for everyone, all providers are right there, and I can tap that person and message them, then that's a real win, not just for me as the ED physician, but certainly for my patient. So that's what we're trying to accomplish from an enterprise perspective. That's what William Osler bought from us and what they're trying to achieve. One of the things as well. What's really, really nice also is that because Lightning Bolt does the scheduling, we can integrate to any secure messaging solution to sort of close that loop on locate and connect and communicate. William Osler uses Vocera, so we will be connecting with their messaging system there. And we can do that with any. We've done it with multiple, not just Perfect Serve, but everybody else as well. And then I'm going to scooch my window up here a little bit. And then the other thing is what we want to do is bring value to the individual providers. So health systems, they can't stay open unless they have providers admitting, taking care of their patients in their four walls. And so provider satisfaction, physician satisfaction in particular, is really important and is becoming more in the forefront today, even for hospital operators, CFOs. They're saying, okay, how do we make sure we're giving tools and surrounding our providers with what they need so that they can continue to practice here and take care of our patients? So our solution is really, really amazing for that provider and for that group, because what it does is create the most equal, using technology and analytics and AI, it creates the most equal, balanced schedule possible and takes care of all of their situations, whether they're in clinic, on call, on vacation, and administrative. So I'll show you a little bit about how that works. But what I love about our solution and when positioning and selling it is, how do we help the enterprise? How do we help the clinicians in the health system? And how do we help that individual provider? So we're going to go across all three of those. Let me see, maybe if I hit return. Oh, the screen's locked a little bit. There we go. And so what I also like to do is start off when I'm talking to a prospective customer. They want to know, what do you do? How's it going to help me? How's it going to align to my goals? And who's like me? Who else has done this? So that I can get perspective of, okay, this solution's going to work for my situation. So with Osler's multi-site system, we have lots of those. We don't have a ton. Well, Telmedic is based in Victoria. That's one of our sister companies in Perfect Serve. But most of our business is in the US. But we give examples of Ochsner Health is an 8-hospital health system. We have children's facilities like Children's Omaha, Boston Children's. We have academic medical centers. We have regional health systems, again, like Tower, Ochsner, who else do I have? Kaiser's a big one. But the reason I show this is so that no matter who you are, what you are, I can relate to you from the customers that we have, so that folks in the room are like, okay, if they can do it there, they can probably do it here as well. It's not so much to tout, or have logos or an eye chart. It's really to try to credentialize us so that the customer feels like their risk is reduced if they go with Lightning Bolt. So let's get into what do we offer? What do we provide value? So I went back to who's on call. I'm a nurse or a doctor in a health system, and I need to figure out who is neurology on call. So what we do is our schedules are on the back end, and the user, just by going to their intranet, they can click on, for instance, the neurology, and then they would see all the neurologists or just who's on call. Or they could look up a particular neurologist and say, oh, they're on vacation, just got this patient, they want to talk to their doctor. So this is really helpful versus looking up on lists. When I practiced nursing, we had lists and they were always outdated, and we'd call answering services and pagers. And so what this does is speed up that speed to care. Okay. Now, what we also want to do through that is, so that was sort of a desktop view. So if I'm let me go back real quick. Whoops, sorry. So if I'm a supervisor, I'm a unit secretary, I'm a charge nurse, I'm not roaming around, so I would use a desktop. So this is available to anyone in the health system. There's no fee for it. We just provide that. Now, if I'm a clinician, if I'm a nurse and I have a mobile device and I have secure messaging on my mobile device, I can also figure out who's on call and then directly connect into the messaging from my device. And what's nice about that is I'll give you an example from a nursing perspective. Everything I used to, my scrubs would have, you know, notes and reminders. I just write on my scrubs. I ran out of hand room, or, you know, papers stuck everywhere. But what nurses do, and what a lot of clinicians do, is try to constantly reprioritize and not forget anything important. And so by being able to locate and connect in a couple of taps, that means that's one less thing I have to worry about. I know the message got out to that provider, and I can go off and do the thousands of other things I have to do before I go home. So that's what we try to do, is, again, show that value. What I also like to do is kind of start talking about, what are we really solving for? Somebody goes, what's the big deal locating a provider? This is an actual flow chart that documented the steps, one of our customers, and how many pieces of friction there are, how many delays there are, how many potential points of failure there are, just to go from we get to the connection page to calling the provider. And the new workflow becomes 3 steps. What I showed you, or kind of showed you on that slide with the phone. So what I want to do is say, we think what we can do can help you solve enterprise down to the provider goal. We're also going to show you how we reduce steps and make things more efficient. And that's what folks are looking for, even CFO. Now, how do we help the individual provider? So if I'm, well, we'll just use neurology. If I'm a neurologist and I have clinic and I have to make rounds and I want vacation, and I'm maybe the department chair and I have admin time, how do I make sure all of that is in the schedule? Plus, I'm not getting messed over on all the weekends on call, right? So what's nice is the back end lightning bolt is going to build and spit out this beautiful balanced schedule amongst my group. And then I'm going to see it and have access to interact with that on my mobile device. Really easy. So if I need to, and my kid gets sick, or not anymore, my kids are all grown, but if I have to take my beautiful pup to the vet unexpectedly, I may need some coverage. And so instead of emailing or calling, leaving a message, waiting for a call back from my administrator or practice manager, I can just say, I'm in trouble, I need some coverage, and send a message out to all the providers as well as the admin staff. And in real time, we can see people say, I can help you, I'll take this shift, picks it up, we swap and trade, I'm done, and I'm off to the vet. And that has really, really, really improved the provider experience. Again, increasing that satisfaction, reducing the friction and time they spend on administrative tasks. And they can customize that, which is pretty cool too. I'm going to skip over a couple of these. One of the things I wanted to share is that I also always try to show not just workflow efficiency, which we did, but also what's the monetary value. So my team and I, along with our customers, have come up with return on investment, or ROI studies. And the one I was describing, that workflow of provider time savings, building schedules, because a lot of times the doctors are building the schedules, as well as managing those changes. For one 700-bed hospital, it equated to about $2 million in saved time. If you think about how we lose providers because they just get frustrated with their practice or with what's going on with call schedule or the hospital, they either go to part-time a lot of times. We see that a lot, or they just say, I'm out of here. And so if you think about not their salaries, but just the annual recruitment, replacement, onboarding costs, for this organization, it was close to $1 million as well. So we've saved money. We've reduced provider turnover, which is continuity of care too. And we've elevated the satisfaction and efficiency of those providers, which is pretty cool. We also show some administrator scheduler, the folks that actually help manage the schedule in the background. and what that savings was for this hospital. Not a ton, but still, we try to fund everything we can, and they're our customers, and we want them. They work for the group, for the health system, and a lot of pressure. And so if we can give them tools and save them time and money, it's another win as well. So let me show you just a little bit about what happens if you're trying to put out a schedule, even if it's digital online, and you're building it, and there's some rules, and the systems on the market can do that. But the problem is they end up double scheduling some physicians like Jones and Caps, and then they just can't fill the schedule. They work the rules and the system, and their brains are like, okay, so then I have to start readjusting as the scheduler or the physician and saying, well, I have to swap this. Well, then that causes a problem here. I have to do that. May end up just calling in locums because I can't figure this schedule out. It's believe it or not, it's pretty hard. So if I have lightning bolt, what happens is the system, the technology, this is where our magic is, takes the same data points, the same amount of physicians and availability, and completely fills that schedule automatically. And so I, as the scheduler, then I just have to worry about things like Dr. Smith wants off. Can I get somebody to swap with Dr. Smith? I'm just helping manage that schedule once it's published. It looks like there's gaps here on the right, but those are just weekends, and we're not doing clinics and OR and that sort of thing. So those are purposefully blank, but this is a schedule, and you see we have short clinics on a few days, but this is a completely built, fully loaded schedule that the system produced based on all the rule sets that we build with the customer. Okay. Now, here's the stuff you need to know too. I talked about all these clinical users and the dollar savings, but while the IT department, this isn't a solution they usually bring forward, certainly not one they really understand or care much about. They matter, and they can block deals, as I'm sure a lot of you know. The things that you have to do, you want to make sure you're bringing them in or teasing these out at the right time in a big enterprise sale. And sometimes our deals will go on, our sales cycles are up to 2 years long. So timing is important, but before anything's going to happen and we get closure, we have to get our security clearance. Protected health information, we have here HIPAA, very similar in Canada, same types of issues there, and really all over. So I use our terms here, leveraging existing investments. So how do we, for a provider scheduling solution, how am I going to give any value to the IT department? Well, I'm going to tell them how amazing they are for picking such an amazing messaging solution that they deployed a couple of years ago. And what I'm going to do is pump that system up and make it even more valuable by pushing in on-call schedules. So what I'm doing is saying, you're so smart to have picked a beautiful tool that helps clinicians. I'm going to even help make that better. And we're going to integrate very, very seamlessly with that. Then the last thing I'm going to do, because a lot of IT departments and are connected with analytics, we're going to give you some real gold, because our system on its own is going to produce a bunch of really amazing analytics, tallies, reports, but we can also shove that out to your database, let you run Tableau or whatever reporting tool that you have, and make you really, really powerful to your end users. I'll just touch on this and then I'm going to wrap, but I also like what health systems worry about is, that all sounds great, Mary. Awesome technology. Woohoo, that's awesome. How am I going to pull this off? We've got COVID going on. We've got construction happening. We're upgrading Epic. How on earth are we going to deploy something hospital-wide or even system-wide? And so this is super high level, but we will walk through, how do we roll? You know, we deploy with you as a team with you, but we take a lot of the heavy lifting and we make sure you're ready and supported. And this can go from, 24 weeks down to 4 weeks if it's a smaller organization and they just want to do on call and not the full optimization. Or if your needs are, we want to go facility by facility, or in Osler's case, they're going 3 big phases with different departments and groups, we can match our timeline and support you however you want to roll. Okay, so here are my pearls of wisdom. Make sure, don't start talking, demoing, or presenting until you are very, very clear. You understand what their goals are. I gave you some generic ones, but a lot of times folks are very specific. And if you're not sure, I love this. I do this all the time. I'll say, why am I here? Why did you guys invite me in? And it's surprising some of the answers you'll get. They're not always the same. And so really understanding what they're trying to achieve and how we're going to fit into that or those goals is really important in the first thing. If you didn't already know that, I think it's probably pretty obvious, but sometimes the obvious and easy things get, overlooked by, hey, let's get in and show that technology. Start with the end in mind. You saw what we do is scheduling, but I started with, how does this help the organization, the enterprise? Then how does it help the on-call, the folks just trying to get on call? How does it help the providers? And then how does it help the individual practices? So start with the end in mind and work your way down. And then definitely, I try to very quickly, but articulate the value for every single stakeholder: IT, COO, CFO, Chief Medical Officer, Chief Nursing Officer, Practice Manager, Physician. So try to articulate the value. IT will block you. I can't say it. There's a time, a place, and the right message, and make sure you're fostering what you say with their IT strategy. ROI, ROI, show value, and try to translate that to dollars. If you're great at sales, you're going to be the SME. And that means you're the subject matter expert, you know the solution, but more importantly, you understand what those users go through every day and what they're trying to do just to take care of their patients. Please always differentiate, not just with the technology as I did, but how we roll and our processes to support you. And we're just really cool people, and we love healthcare people. So differentiate not just your solution, not just your company and people, but also how you roll. I love creating value collaterals, not marketing slicks. So I tend to, there's still a one pager or there's still a document we send, but what I love to do is create a landing page using basic tools, and so that it's interactive. I have videos of customer references. I have videos of our company, and I have online documents that can be downloaded. I have tutorials that they can go through in some of the education, and I create a landing page for that customer. They can just go there or send other folks there anytime during the sales process to learn more about what we do and to support our differentiators. Okay, the last thing, clinical, operational, IT, and end users. You got to win them all to be successful. So this should be like 1, 2, 3, 4, 5, 6. I was going to say like the 12-step program, but I think it's only 10 points there. But that's all I have in the time that I have. And thank you for listening. And I can't wait to take questions later.
Thank you so much, Mary. Let's see, 1 second. Okay, perfect. This is a fantastic presentation and a really great overview for our audience members to see how Lightning Bolt works, the value proposition you provide, how you differentiate your company with other scheduling companies. And, I think you've provided a lot of great golden nuggets for our audience members to take away. So now we'll move on to a brief writing exercise. And we'll just have Albert share his,
Yeah.
okay.
She has to give it.
Okay.
Change role to attendee.
Let's see. If you have the ability to do so. Okay. And
Oh, no, oops.
so,
Not sure.
1 second.
Oh, pause, stop share. There we go. Sorry about that.
Okay, no worries.
I can't share. Can you make me parents?
Okay. Okay, let me just change. Mary, currently I've assigned you as host.
Okay.
Do you have the ability to change your role?
Yeah, I'm gonna try it. Oh yeah, here we go.
Okay.
Sorry about that. Make host. There you go.
Okay, perfect.
I'm sorry. I thought you were just letting me share. I didn't know you made me the host.
Oh.
That's way too much pressure.
So many different options. Okay, perfect. So I think Albert is back now.
He's mute.
And okay, great. All right, so now moving on to a really brief writing exercise. Now that we've heard Mary present, we'd just like for everyone to just take a moment to think about how can Lightning Bolt improve physician scheduling? And I'll just play some background music here. You to our
Thank you, Sandy, for that warm introduction. And thank you, Mary, for taking the time. I really learned a lot. Even I'm still learning about Lightning Bolt. And I'm sure many of our webinar attendees are learning about Lightning Bolt for the first time because you are only just starting to penetrate the Canadian market. So we'll be glad to be working with you for the next little while. Just advance my slides here. So for me, that's someone that has worked in hospitals for a long time. Navigating those hospital dynamics can be very tricky. And one of the secrets that I've learned is that hospitals aren't the only decision maker. So here in Ontario, there is another organization. It used to be called Shared Services Ontario. Now it's changing to Ontario Health. And they actually manage a lot of these contracts on hospitals' behalf. In particularly, hospitals can't really sign contracts independently as much anymore, depending on the value of the contract. So basically, there is going to be that third party. So you have a vendor such as Lightning Bolt, you have the hospital, and then Ontario Health. All three do need to sort of agree on the terms of those contracts. So for example, what's going to be the service level agreement? Who do you call when this breaks down? The time of the contract, the length of the contract, all of those things are taken into account. And selling to hospitals, from my experience, is also something quite difficult because of the different people that are involved. I jokingly say, beating the bureaucracy, but there is, some tips that I can hopefully share with you. So, for example, in Ontario, these are some restrictions that I can share with you if you are in a position where you are looking to sell something to a hospital. Now, no contracts can be longer than 2 years in length because of some of the rapid change. If you had asked me a year ago, Ontario Health did not even exist, right? So that consolidation of healthcare agencies, it's just starting to occur. And any contract over 50,000 must go to Ontario Health for that review. And that's also something that to keep in mind. The average review time, from what I've noticed, is maybe 3 to 6 months, but it can certainly be a lot longer. And I find that it's typically the mature vendors with long-standing relationships and a track record of success. Those are the ones that are really going to be able to get past that bureaucracy. So let's move on to physician leadership. So that's something that I always love to talk about because, I work with physicians all the time, and they are a key stakeholder within the healthcare space. So this is a typical physician leadership structure that you might find in a hospital. So you have the frontline physicians that are providing the hands-on care, and then you have a chief. So every physician typically does report to a chief, but then there's also multiple chiefs because, for example, even within surgery, there's maybe 6 or 8 subspecialties, and each one will have their own chief. And then if you have different sites, so in those sorts of case, if they're a 3-site hospital, they're going to have 3 chiefs, 1 for each site. So you can see that there is going to be different layers of, well, depending which site you're going to, then you have to talk to this chief. And then some programs even also have a medical director, which is sort of like the equivalent of a chief. And then on top of all of that, you do have the CMIO. So this particular role is a pretty key role. I believe that most hospitals in Ontario and Canada do have something along those lines, and it's the Chief Medical Information Officer. And this physician leader is highly attuned to new trends in the industry. And if they hear about innovative solutions such as Lightning Bolt, they would be sort of understanding, well, is this solution right for our organization, and what are the other trends that are coming? So this is a key role to be aware of. And another body is also the Medical Advisory Committee, also known as MAC. And this is also kind of a provincially mandated group, and it's sort of the highest decision-making body within a hospital that focuses on physician-related issues. And typically you might go there for approval for certain motions or changes in policies and procedures. So, even if you do have the structure of the physician leadership, unfortunately, you're going to have different gatekeepers, and that's what those little squiggly things are. Let me see if I can show that. Okay. So there's also gatekeepers that you do need to kind of get past, even to get to those different groups. Okay. So this is only one side of the house. The other side, and before I move on, so to summarize, some tips for someone like yourself, if you're either a sales organization or a company that's trying to reach those physicians, engaging with the CMIO, keeping your communications and meetings brief and succinct. They don't have time for hours and hours of demos and phone calls. It's got to be straight to the point, I find, and having a track record of success really helps. And Mary even touched on that, demonstrate peer adoption. If another hospital that's of a similar size and type has adopted that particular technology, that is a great selling point, because then it just shows it works in that region where that hospital operates. And be prepared for a long sales cycle of up to 1 year or more. So the other side of the house, and before I move on to that, these are some other ways for physician engagement specifically. So there's division and business meetings, where these typically happen on a monthly basis, where there might be chances to engage with a larger group of physicians. I find that sometimes one-on-one meetings may be needed. Another way is actually going to conferences and medical education. All physicians do have continuing medical education requirements. So there is always opportunities to engage with them there. a short video, and even demonstrations if appropriate. So these are a couple of strategies specifically for physician engagement. So now let's move on to the other side of the house. So you have the administrative side of the building. And something I always love to point out is that physicians, for the most part, are not employees of the hospital, right? They're independent contractors that kind of use the hospital facilities, but are kind of at arm's length. So these are the actual employees of the hospital. So you might have a manager, a director, a VP, and then SLT refers to the senior leadership team. So depending on what your product or solution is, you're going to have to talk to at least some of these types of people. And I find that it is also difficult to find out who the manager is, because sometimes if they're on vacation or there might be an interim manager, there's always going to be different, there's a rotation of that leadership that occurs at that level. If a higher level contract, then you're going to have to talk to a director, and this would be a director of a program. So they might have 6 to 8 managers that report to them. So they would, let's say, sign off on something that affects their entire program. And then if you're affecting the entire site for a particular hospital, then you'd have to get to the VP level. And at some point, certain things would need to go to SLT as well, right? Each of those also has their own gatekeepers. So I can't just call them up and say, hey, I'd like to pitch you on something. You're gonna have to, email their admin, make a time, and their schedules are quite busy. They get lots of different requests. So that gatekeeper is gonna be filtering out, and seeing how critical your request is and schedule them accordingly. So you do need to be patient, I find, in order to get to that right decision maker, and then catering your message, because what you talk to a manager about is going to be completely different what you talk to SLT about. Some tips for success I definitely want to share. This will vary by hospital and by region, but each of those layers will have different signing authority amounts. So these are some amounts that you might see. So depending on the size of your contract, you're going to have to get the appropriate signing authority. Demonstrating peer adoption is another key point. If another hospital down the street has done something similar, that's going to be huge, and will hopefully get you to that decision maker a lot quicker. Data to show pre and post implementation. So this is something that I find that some vendors don't have an idea about, and that's something that if you can say that prior to adoption, this is what our wait times were, or this is what our budget was. After adoption, there should be some change, right? How have you saved time? How have you saved money? Being able to demonstrate that is going to be huge to show that your solution actually works. Because if you don't have any data to prove that your solution works, well, guess what? They're going to end that contract and move on to someone else. And then face-to-face meetings I find are kind of key, especially for those first meetings. So even in COVID, if you can't meet face-to-face, even by video, I think it really helps. So now I'd like to have you think about how you might be able to use this information. I'll pass things back to Sandy for a quick writing exercise.
Great. Thank you, Albert, for your presentation. It's great to be able to learn about the hospital structure and who are the key decision makers. And so for our next exercise, I'd like to be able to take a moment for you to think about what strategy will you use to connect with decision makers. And okay, so now that you've had a moment to think about how you'll be able to connect with the decision makers, we're now going to open up for Q&A. So if you have any questions, feel free to type it in the Q&A box. Now looking through here, let's see if we can bring Mary back on here. Okay, so now we've got Mary here. And if you'd like to unmute yourself. Perfect. Great, so the first question for Mary is, how does lightning bolt work for other types of clinicians, such as nursing and allied health?
Yeah. Hey, thanks for that question. Here, I am a nurse and didn't even talk about that. We're primarily a provider scheduling, but we also schedule nurses and other ancillary staffs, particularly around clinics. What we don't do is try to take on like inpatient acute care setting scheduling, but we can do anything in the outpatient. And cool fun fact, we actually schedule a lot of veterinary clinics. I love dogs. And we've even done scheduling for large restaurants. So think about, so it's not just healthcare as we think about it for humans, but we do, again, others. And yes, anybody working that needs to be aligned with providers, a lot of times like a provider and a tech like to work together. They kind of see the same patients, they know the routines. And so our scheduling solution can support that as well. Thanks for the question.
Perfect. That's really cool to hear. And we do have another question here from our audience, and they're asking, how can I go about calculating the reduction in time, cost, and or resource savings that my product can bring to a hospital?
I guess maybe I'll try and answer that one. That's something that if you can't find the data, then you're going to have to make some assumptions to collect that data. You're always going to have to make some assumptions and estimate so that you actually can show something that in terms of pre and post implementation. So hopefully that gives you some direction as a starting point.
Can I have one?
Okay, perfect. And another question for Mary: how can one get a demonstration of lightning bolt? It looks like a really unique solution.
Well, you'll have my contact information, so you can reach out to me directly, and then you can also request a demo right on our website, which is lightning-bolt.com. So you can just go there, check out the website, you can request a demo, and our team will jump all over it. But I'm happy to help you directly too.
Amazing. Okay, perfect.
Can I just add a little teeny thing, Albert, to what you said on the ROI question, just because I think it's so important. One of the things that, if you're lucky and you have a big customer base like we do, sometimes we can't get into that prospective customer and get their data, as you mentioned. But what we can do is we have data from other customers, and we can say, hey, this is a collective of our cohort that you could extrapolate from. And then the last thing, if we still don't have that, what I've done is gone to research, published articles around burnout, for example, and the subjects that are hard to get data on, but some research has been done. So I use that as the marker for the ROI as well. So sorry about that. I thought I love that component of the sales process, so I wanted to share.
Thank you. Yeah.
Okay, great. So just in the interest of time, that will conclude our Q&A session. And now I will pass things back to Albert.
Thank you for everyone that submitted questions. So we'll just close with a few things here. So if you like what you've heard today, and you'd like to get a little bit more coaching, that is something that I do offer. This is the entire 9-step Healthcare Hero sales process that I do go through with my coaching clients. I would say that the preparation is the key, especially if you're someone that's new in sales, you haven't done this before. And I'm very surprised the number of people that end up in sales, especially in healthcare, and they don't know anything about healthcare. With the right mindset, tools, and theories, you can get a good foundation to get started. And then you move on to the second step, which is that implementation, right? So the Hero Sales Method is something I do have posted on my website. It's just a way to look for prospects and evaluate them and suggest solutions in a systematic way so that you can get them to down your funnel, and so that you can get to the right decision makers. And then as you get into the planning and goal setting, then you can really start to optimize your sales process so that you always have that constant prospects that are coming into that funnel. And then you get into that the last 3 steps, right? And when you're really performing, you're practicing and looking for ways to really optimize things and measure your success. Because there are going to be differences between different sales leaders. Certain people are just more adept at continually improving and learning, and those are the kinds that really end up succeeding because they have a process and they can keep pushing forward. So that's an overview of the entire process. So I do offer one-on-one coaching. If you're someone that would like a little bit more assistance, if you like what you've heard today, I would love to dive deep into your specific problems. I want to hear about your customers and your problems so that I can try and offer my insights and solutions to help you. We have something like monthly strategic consultations. I go through that 9-step process. And as a bonus, you actually get access to the group coaching sessions. You get unlimited email support. And normally this retails for $39.99 for the year. But today, for people that are watching and listening, I do have a time limited promo code, consulting20, you get 20% off. So that's specific for one-on-one coaching. And if you don't think that's right for you, I also do have group coaching. So that's for up to 6 people. When we go through the 9-step sales process. So it's similar to this, so it'll be in a group format. We'll meet on a monthly basis, and people can kind of work together and sort of mastermind, is there anything else that we can do to help people in our peer group? So these are all people that are in healthcare sales, and you get unlimited email support still. So this is for 1 year, and normally this retails for $4.99 for the year. And today I'm also offering for the very first time a discount promo code valid for the next 5 days, so coaching 20, and you get 20% off. So those are 2 great options if you are looking for a little bit more support. And now I'll end with a sort of a closing story to sort of share some of my experiences. I mean, when you're someone that is a field sales rep, so this is a couple years ago when I was in medical device sales, you might divide up your territory into different quadrants, right? You're going to have the northwest quadrant, the northeast quadrant, the southwest quadrant, and southeast quadrant. And I would love to sort of say, Mondays I would go to one area of the city, Tuesdays I would go northeast, and Friday I would kind of tie everything up so that I would have sort of a systematic pattern. And this is when I was calling on sleep physicians. So you can tell that they're obviously very busy. I would have to plan out my day and say, okay, on this day I'm going to go to this area, and I'm going to call these sleep physicians. So one particular day I had a new area of the city in Toronto in mind, and I planned out exactly what I was going to do. I'm going to call them these sleep physicians. So I tried to call them up on the phone. I'd call and then no one was picking up. I thought, oh, okay, maybe the admin was just busy. I couldn't make an appointment, but I figured, oh, there's a whole bunch of them in this area. I'll be fine, right? So I put the address into my GPS, hop into my car, and head on over to that location. And I couldn't find it. I was like, where is this office? And I looked around for 20 minutes, and I double checked on Google Maps, and I double checked the addresses and phone numbers, and it says it should be right here. Lo and behold, this is what I found. The office building that I was looking for had been torn down, and they were turning it into something else. So I'd wasted, that day because I was planning. I had a whole bunch of people that were in this building that I was going to reach out to. So the moral of the story is that, no matter what happens, and I love sharing the story because you could tell how embarrassing it was having to go back to my team and say, I didn't check Google Maps properly enough, or it wasn't updated, and I wasn't able to connect with those sales prospects that day. So hopefully that encourages you to continue going on, because I don't think that you can't even make this stuff up. Hopefully this hasn't happened to you before. I'll pass things back to Sandy just to give some closing remarks.
Great. Thank you so much, Albert, for that enlightening story. You never know what can happen, in your job. So just wanted to wrap up here and thank everyone for attending today's webinar. And as a token of appreciation, you will be sent an email where you can download a copy of Checkmate. And I also do have a special message from Albert's book publisher, Blackheart Books. So Albert, would you like to play that? Okay, just a little technical difficulties, but that's okay. And just to, be able to mention that Albert has been endorsed by many other notable authors and by Gerry Robert himself. He speaks on stage with Tony Robbins and also Unstoppable Tracy. She's local here in Toronto. So really cool. And to see that Albert's really making a difference in the healthcare sales industry. And for those of you who do purchase a copy over the next 5 days, it will include a complimentary 1-hour sales strategy consultation valued at over $1,000. In addition, Albert is really proud to be partnering with Prostate Cancer Canada. And for every book purchase, he will be personally donating $2 towards this charity of his. And you can use a special promo code, Checkmate, on his website, where you will be able to receive the book for only $20, includes free shipping, where it's typically retails for $32.99. And don't forget to stay in touch, and let's just keep being social. You can find Albert on Facebook, Twitter, and Instagram there, where you can say hi to him and ask him any follow-up questions that you may have from today's webinar. So that's all for today, and to thank you guys so much, and we hope that you enjoy the rest of the day, and we'll see you guys again next month. And thank you so much, Mary, for coming today to share so much about Lightning Bolt. Great. Thank you. Bye, everyone.